Today, we're going to be talking about plasma technology.
People always talk about their turkey neck. What are you doing with chicken?
So I wanted to take a little bit of time and actually just dedicate this episode to talk about those technologies and what we have available in our practice.
I think Chris forgot to say who he was.
Yeah, he thinks I forgot my name. I said I didn't, but hi everyone, welcome back to another episode of Beauty and the Brain, the podcast where we discuss all things aesthetics. I'm your co-host, Dr. Chris Croley.
And I'm Jerry Drinkard, family nurse practitioner, and together Chris and I own Skin and Tonic, a med spa located in Pace, Florida.
And if you guys could see the behind the scenes on this episode, you'd see we had a lot of trouble with that introduction today.
I think Chris forgot to say who he was.
Yeah, he thinks I forgot my name. I said I didn't, but regardless, we have a very fun topic today. We're going to be talking about plasma technology. So hopefully we'll get through this topic with a lot more ease than we did our introduction.
People always talk about their turkey neck. What are you doing with chicken?
For those of you who are listening right now, go on over to YouTube and watch us. Jerry's talking about this chicken breast and what we're going to do with it. It's actually here so we can do a demonstration with the PLEXR device, show you what we can do with some of the plasma technology, and you'll see actually some tightening kind of right in front of your own eyes. So stay tuned until the end because we'll be doing this demonstration at the end. So we are probably the only provider, at least the only provider that I know of in the area, that is offering such a wide array of plasma technologies. So I wanted to take a little bit of time and actually just dedicate this episode to talk about those technologies and what we have available in our practice.
Well, I think we're very fortunate, like you said, to be one of the only clinics in the area, possibly the only clinic in the area that is offering this, and it just really improved our ability to treat so many different things. This technology has been around for years in Europe. It's relatively new to the States, and the possibilities are just endless with it.
Yeah, and so for those of you who are listening, if you missed this, we've done a whole entire episode on the Neogen PSR, which was our first plasma device, and we had that now for, almost 2 years, and had really, really good results with that. So go back and listen to that episode if you want to hear details about that particular device. Also, want to let you guys know throughout this episode, if you're watching us on YouTube, so I know a lot of people listen on the Apple, the podcast app, or through Spotify, but if you want to see some before and afters of the procedures we're talking about, go on over to our YouTube channel, and that link is going to be included in this podcast. But on that channel, you're going to be able to see before and afters of every procedure that we're talking about today.
I think it's also important, kind of at this point in the podcast, just to clarify, because we've talked about plasma in our practice for 15 years, but this is a different type of plasma. We typically talk about plasma in the state of PRP, platelet-rich plasma, that we've used in a multitude of our treatments, but now we're talking about a whole different type of plasma.
Really what we're talking about today is an energy-based device, our plasma being like the fourth state of matter. And so when we think about that, we have examples in nature of plasma type of energy. Is going to be the sun, it's going to be lightning. Those are different things, stars, right? I mean, so all of these things is going to be all from different types of energy. And so with these devices, different manufacturers, different companies have found ways to generate this fourth state of matter. And so when we talk about the Neogen device, that's when we're using a nitrogen plasma tank. So it's a medical grade nitrogen gas. And that is attached to this machine that has a handpiece, and it has a radio frequency generator, and that uses energy to create this ball of plasma energy that we can then deliver into varying depths of your skin. So we can either be pretty superficial with that and do a very light treatment, or we can go pretty deep with that and have a more aggressive treatment. It's going to create collagen, and you're going to have remodeling of an entire architecture of your skin. And so really we see some immediate results. But the amazing thing about this is this energy, and by putting it in the right layer, you see improvements that continue up to a year even, patients are having improvement.
And like we were talking, there's so many different things that you can do with this. I think one of the most common is like skin tightening, and like resurfacing is probably not the appropriate way, but to remodel the surface of the skin. And so we're treating things like skin texture, skin tone, crepiness of skin laxity. And then the other thing we're doing with this is doing scar revisions. And we get some of these photos uploaded that have some pretty amazing results with minimal downtime, considering, the extent of the result that you're getting from it.
So one of the things that you and I recognized really early on with the Neogen is that we have had devices in our practice for the whole time we've been in practice almost. And one of the first devices we had was a CO2 laser, and it was pretty aggressive. And any of our patients that saw us, maybe 12 or 13 years ago over in our Mobile office, Mobile, Alabama, they know that they had significant downtime. If we were going to do the CO2 laser at that point, we knew that they were going to need, 10 days, 2 weeks of pretty significant downtime. And based on the area that we live and the type of patients we were seeing in the practice, we didn't do tons of those treatments. We knew it was a great result, but getting them through that process to get that result was it was a challenge for us and for the patient. So we were a little bit hesitant to add new devices into the practice over the years, and the Neogen was one of the first things that really, to me, lived up to the hype around the device. We have a lot of other great devices in the office. I don't mean to knock any of them, but the Neogen really, it had a lot of hype around it. And when we saw the before and after pictures, we questioned if they were photoshopped.
We saw this for months before we took the plunge to make the purchase. Some of you guys may follow Sean Charles, but their results were just absolutely amazing. And then Angela and Rob, the owners, they were continuously showing us, different photos like, you won't believe this. And then we started seeing changes in Angela herself. And she looks like it has literally turned back the hands of time.
Yeah, Angela looks like $1 million if you guys see her. She's over, you guys can follow her or go over to Emergent MedTech and see some of her photos. And she's phenomenal. She looks amazing.
My first personal treatment was done by Angela in New York. And my result was, like, I've always battled acneic skin and some old acne scars, and it was the best thing that I've done to my skin. And so I was a pretty easy sell, and I'm always the one that does not want to spend money.
Yeah, Jerry's always one reeling me back in.
I have to reel Chris in, and I was ready to jump on board with this. And so it's just been a great addition.
But what we noticed about it right away, it was really promoted for skin types 1 through 4, so that's the lighter skin types. But from a lot of discussions with Angela and looking at their clinical protocols, we also knew that we probably could treat our darker skin types, our Fitzpatrick 5 and 6s, and have good results. And so we started doing some of that. And what was fascinating is when we started having people ask us if our photos were photoshopped.
Yeah, that's like one of the best compliments you can get.
We love it, because when they ask us, have we doctored the photos in some way, when we really haven't, that's great. There was a little bit of a learning curve with it, but of all the devices we've had, I would say that, we learn things pretty quickly. We did have a few patients along the way, and fortunately they were early on, and they were patients that have seen us for years, and they were kind enough to be some of the early adopters and models for this. And so, we had some pigment things where this really helps remove and even skin tone and pigment. And it was more the way we used the device, but we had skipped some lines, and you could actually see exactly where the pigment was.
Maybe we can insert one of those photos, and they'll be able to see it on YouTube.
Yeah, that'll be great. We'll get Sierra to check into that and see if we can put that up and show how we missed the areas with the stripes, but then we went back and corrected it, and really had some phenomenal results with that patient. And then we got better at using the machine, and we do those treatments almost daily in the practice now. It's one of our most in-demand treatments. The other great thing about it is we don't have a lot of devices that we can treat all the way up to the lash line. We have to really stop on the bony part around the bony part of the eye for many of our treatments. But with this device, we can go all the way up to the eyelashes and really get some nice tightening of the eyelids, and treatment around like the mouth area, where we get right up to the line of the lips with this.
Yeah, I think being able to offer something for the actual lid tightening rather than just lifting that we've been able to do with neurotoxin or threads, I think to actually tighten that skin safely has been huge. Some of the results are just phenomenal. Like I probably would have been able to avoid a bleph if I would have started this therapy years ago.
Well, kind of the your real point of this podcast and why we talked about doing it was because we did this, we got this device, we've had amazing results, we continue to have amazing results, but we also realized that this plasma technology was something unique and it was different. And there's a lot of devices out there that are talking about being plasma energy, and they're not truly plasma energy. Maybe they're causing a burn, or maybe like an electrocautery unit of some sort, and it's burning. It's not really creating plasma. So with the Neogen, we know for sure that we're creating plasma using a nitrogen gas and a radio frequency generator to create that plasma. But we also have another device, and this is where I think that the reason we're doing this separate podcast is that, we really identified that this technology was valuable. And probably for me, the first discussion that you and I had was I was asked to do a webinar. So Neogen got approved in Canada by Health Canada, and as they introduced it, they asked if I would do a webinar because they wanted to talk to a successful practice in the US that had been using this technology. And the plasmatology group was kind enough to ask me to do this webinar with them. And it was a great experience. But as I was preparing for it and talking to them, they have done theirs in a little bit of opposite of what we've done in our practice. So they carried this device called PLEXR Plasma. And they had that for years. That was kind of their primary device. And then they saw the possibility of what they could do with Neogen and decided to, once that got approved, they brought that on board. And they were doing a lot of different combinations with these two devices.
I think they can complement each other.
Yeah, they really can. And so June from Plasmatology, June, if you're listening, hi, and thank you for all of your words of wisdom and advice here. But her photos really got me to talk to you. And I said, maybe we need to actually look at this and consider how we can combine these two.
Yeah, we've recently introduced it at the clinic, and we've had some really nice results. I think with any of these devices, there's a learning curve, and I think there's also an education component to prepare the patients, because it is a little different than some of the other devices that we've had in the past. It's a lot different than other devices we've had in the past, actually. But I think as long as you prepare your patients, that they're willing to go through that downtime for the results that you're going to get using these plasma devices, especially using the combination. And I'm really excited to see some of our results using the combination of these plasma devices with the biostimulants that we've been using for years.
Yeah, I mean, of course. So anything that we're doing to really stimulate collagen, when we start doing multiple modalities that are going to stimulate that, I think our results are even going to be better. So I'm with you on that. I can't wait to see these patients that are getting the combination of all the different things that we have right now. We've done that already with the Neogen and seen phenomenal results. Now, how we're going to mix this in with the PLEXR, I'm not really sure. So a lot of people out there look at this and they think it looks very similar to some of the other technologies, and there's a lot of different brand names out there going on. But basically, this device is a small device. It's a handheld device, and it looks like a little pinpoint that we can go in and very selectively basically remove some tissue, right? We can even do, I hate to use the term soft surgery, but that's what they use a lot. And so if you have a lot of loose or lax tissue, we can actually remove that with this device. And then we can use our Neogen for overall facial tightening. We're really stimulating a lot of collagen formation. And so using the combination of the two, where we can actually take excess tissue out in one area with one, and then cause an overall rejuvenation, evening of tone, and stimulation of collagen with the other is great. But in addition to that, what we also have with this new PLEXR device is something called the PLEXR Shower.
Which is one of your favorites.
It is my favorite.
The PLEXR Shower delivers a more broad-based deliverance of the plasma energy into the skin, rather than the focused energy that we use when we're removing some of the deeper rhytids or a mole removal or whatnot. And so Chris came home from, I think you were in New York actually, when the first time you came home, and told me he had had this treatment and how wonderful it was. And I figured that it must have been something that felt good because he doesn't do anything that's uncomfortable. And then his skin continued to get better over the next few days. And so you've now had 3?
I've had several, and and I usually like them. If I ever see Arash, he's one of the reps that carries this device, and we really have seen good results with it. And he'll be kind enough to do it for me before a presentation, so I kind of get a glow for that weekend. And now that we have it, I actually want to bring the device with me. It's like I tell Jerry,
it wasn't in the clinic this week.
Yeah, so it's a device that I really want to take with me because I love the way it looks for events. It kind of helps us do a procedure similar to microneedling, but we're using plasma energy instead. So this energy is opening up these channels that we can put an active ingredient on. And so the PLEXR, we get it from Arash as a great contact. He's with Med Results. And so we'll put contact information to get in touch with him or Med Results if you're interested in learning more about these devices. But also we have some great active ingredients that we place on after these procedures that has hyaluronic acid with a signaling molecule in it that's going to help stimulate your own collagen development.
And the channels that are created stay open 4 to 6 hours, so it gives you a great way to deliver serums and that sort of thing at the time of treatment, and also for the patient to take home. It gives enough time they can also have an additional application at home.
Right.
So we have some of the post-care treatment is focused around those channels remaining open. So we don't want someone to be out in open waters, swimming, exercising, that sort of thing for the next several hours afterwards. So post-care treatment is really important with these treatments as well.
Yeah, so I think that's really, also going to be mostly related to when we do the ablative treatments with the swimming, because we don't really want you to go in swimming, but with the PLEXR shower, you can really kind of go about your life the way you want to. So it's best if you leave the things on top, but if you have a gym or a workout or something that afternoon, by all means, you can still go and do that, where we really don't want you doing it with some of the more aggressive treatments. So if you're concerned about scheduling these, call and talk to us more about the post-care and how we can customize it. So really, what I would love for you guys to do, if you want to know more about these plasma technologies, is go over to our website, check us out at skinandtonic.pro. We'll have a lot of information on there. Watch this YouTube back. You can see before and afters of what we're doing with these combo therapies. Stay tuned, because we're going to do future episodes where we talk more about each device in detail and why we pick one for a certain area over others. But know that we are one of the only practices in the whole Southeast region where we're providing these combination therapies, where we can do not only your biostimulants, but we can do different forms of plasma energy really custom to meet your particular needs.
And you can always come into the clinic for a consultation so that we can determine the best treatment for the best outcome for what the patient's wanting.
Absolutely. Okay, this is demonstrating the PLEXR Plasma, and so this is one of the ablative forms where we can actually remove excess tissue. So for those of you who are listening, who are not watching right now, what we're going to do is take this chicken breast, and I'm going to show how we can take the tip of this device and actually create small little channels to remove excess tissue. You see this just is creating small little burst of plasma, and everywhere we put that little burst of energy is going to stimulate collagen. And with this particular device, we're actually also removing a little bit of tissue in that area. This is going to be safe for all skin types. Obviously, this is something that you want to make sure that you go to a trained provider. In addition to using these little controlled micro injuries to stimulate collagen, provide lifting and tightening, there are other things that we can do as well that have a little less downtime, a little more. This is the most common treatment that we do for ablative therapies, or things that we would do where we want to treat mild lid laxity. So if your upper eyelids are drooping a little bit, we can do this procedure right on top of your upper eyelids, and you'll get a lifting effect. It's going to take probably around 4 weeks to see your full result, but you're going to start seeing some improvement starting probably around week 2 to week 3. In addition to providing collagen stimulation and lifting, there are other things that we can do that are a little bit milder. This is called a scratching technique, and basically it's where we're going to go across the whole skin surface, and this is delivering plasma energy. And with this type of therapy, we'll just stimulate collagen development. So it's not going to be quite as aggressive. Your downtime or your healing time from this is pretty quick. It's going to be just 2 to 3 days. And before you're going to start to see a nice glow. And then finally, we have the PLEXR shower, which is going to be an even lower energy setting. That's kind of more like the microneedling type of treatment, where we open up those channels and we put some sort of active ingredient for better penetration. Depending on what your individual results or goals are, we can customize that treatment to you.